there. If you can just take a picture of or focus in on the QR code. We use the Mentimeter. We use it for the we do a little quiz at the beginning, but also we use it at the end for very brief feedback at the end, where you can tell us whether this met your learning needs, but also what you'd like us to cover again in the future. So please, if everybody is also, now one of the team will have put the Mentimeter also in the chat, so you can open that as well and just link onto that. I can see there's lots and lots of people there loading up the Mentimeter, and we are recording now. Okay, so first things first. Now, I can't actually see the question. Can you all see the question there? Because I can't actually see it on my screen. I'll just scroll to it. So here we are. What percentage of secondary school students in Wales reported at least 60 minutes of physical activity every day in the last 7 days? 8%, 18%, 28%. So we'll just wait for people to log on with the Mentimeter and wait for people to do their votes. We'll just wait for things to settle down. Still got some people clicking their votes through there. Okay, so shall we move on to the answer then, please? So yes, so actually, yes, so 18% of secondary school students in Wales reported at least 60 minutes of physical activity every day in the last 7 days. I'm amazed it's actually that high. So I think that's actually really quite, that's much better than I would have expected, but absolutely, but obviously not as good as we would hope, where we'd hope it would be 100%. But anyway, okay, moving on to the next question now. So are boys or girls more likely to do at least 1 hour of physical activity every day? So yes, so we've got the majority of people are going for boys. 82% of people have thought, 83% of people have thought boys are more likely to do at least 1 hour of physical activity every day. And the answer is actually, yes, indeed, it is boys. So yes, boys are much more likely to be doing 1 hour of physical activity every day. Apparently, among 7 to 11-year-olds, it's 34.1% versus 26.8%. But then when you move on to the older age group, the 11 to 16-year-olds, it's 22.8% versus 13.7%. So it gets really a lot bigger as the children get older, and the gap between the boys and girls changes there. Alrighty, so the next one. How many online junk food adverts are children in the UK exposed to annually? So we've got 15 million, 150 million, 15 billion. I think have people mostly voted now? No, it's still changing. So actually the answer to this one is 15 billion. Isn't that astounding? The thought that actually there's 15 billion ways in which online junk food adverts are being accessed or being shown to our children and young people across the country. So anyway, moving on. What percentage of secondary school children in Wales report eating at least one portion of fruit or veg per day? That's one portion, not the recommended 5. People are still voting away there. We're still changing. Right. So what have we got? So, yep, so the actual answer is, so 69% of you, yeah, the majority of you were right. So the answer is 46.5% of secondary school age children report eating at least one portion of fruit or vegetables every day. That's really scary, isn't it? You know, when you think about it. So that comes from data, and that's from 2023. So yeah, fantastic. So moving on then. So really, what are the things that we can do about this? Well, today we've got four fantastic speakers. So basically, the first ones we've got who are speaking are Nicola. Nicola's a principal public health practitioner at Public Health Wales. She works within the National Children's Healthy Weight team with a focus on early years. She's got over 23 years of experience in public health and a background in community development. She brings a systems thinking approach to improving infant health across Wales. And collaborates closely with stakeholders across Wales to give meaningful change. She's particularly interested in the behavioural science side of things and its application. And then joining Nicola is John. John Bradley is the current National Programme Lead for Physical Activity at Public Health Wales. His career in public health started in 2010, and he's been part of both local and national teams. Working across lots of different areas of health improvement, including health improvements and health protection, including tobacco control, alcohol harm prevention, seasonal influenza, cardiovascular risk, COVID, and physical activity. So without further ado, I'm going to hand over to both of them, who are going to do a double act during this one, I believe.
Hi, thank you. Yeah, as Claire said, I'm Nicola Gordon, and I'll be talking today with John, alongside John today, and we'll be talking a little bit about what everyone in the NHS can do to help children be healthy and active. We'll also give a little bit of context and some things about what we are actually doing as well at the moment in terms of this work. Can I flip the slides? Is that, or does somebody have to do it for me?
The team will do it for you. So because it's all part of the Mentimeter. So just say when you want next slide and they'll do it.
Oh, no problem. So just to give you a bit of context really about where we are in Wales in terms of children's healthy weight. Most recent stats show that currently in Wales, 1 in 4 children aged 4 to 5 are overweight or obese, and 1 in 10 of those are actually obese. And this is actually higher than our neighbours over in England and Scotland as well. So that's quite a lot of children, of children in Wales at the moment, just to put that into context. And we know that of those children, the most children in most deprived areas are more likely to be overweight. And this is a trend that's been increasing over the last 10 years. So it's not necessarily getting any better either. And in terms of other things that obviously influence weight in terms of food and physical activity, we know that many children and young people in Wales fall short of what the national dietary recommendations are. They have a diet that's low in fruit and veg, high in processed food, sugar and fizzy drinks. And also that most children in Wales don't meet the physical activity guidelines. And John, I don't know if you wanted to come in here to talk about any physical activity.
Thanks, Nicola. Yeah, just to expand a little bit more on those Mentimeter questions. So we obviously demonstrated the difference between boys and girls through primary school to secondary school. But if you delve a bit deeper into the available data in Wales, there's also big differences in ethnicities and also most deprived to least deprived. So for example, in primary school children, the most deprived is about 26-27% are physically active for 1 hour a day, every day. And for the least deprived, that's up to a 40%. So there's huge differences between lots of different demographic variables. Unfortunately, they often track through to adulthood as well, especially the differences between boys and girls. Thanks, Nicola.
Thanks. And if we can move on slides. Thanks, John. Yeah, and picking up on that really. So I just popped this in because it just kind of showed different generations and how things have changed over the years, and that's due to like the environment we live in as well. So this is basically showing two studies that were conducted. One was conducted from people born in 1946, and then one from people born in 2001. And basically, it's just showing that back in 1946, people born there, when they hit 11 years old, they would say 1 in 10 children were obese by the age of 11. But when you fast forward that on to 2001, the children born then, when they hit 11, there was 1 in 4 that are overweight or obese today. So it's just kind of showing that all the things in society that have changed, the environments, and all these things have been impacted, and that trend is going in terms of weight as well. So it has been changing over time. Move on then, thanks. So why does it matter? We know that healthy weight in childhood and childhood obesity has long-term health inequalities, the impact on that. And that optimal nutrition and physical activity is essential for a child's development. It's the foundation of well-being, growth and development. It supports physical, social, cognitive and emotional milestones, influences bone and muscle growth, brain development, oral health. It has an impact on health and education and attainment. And there's long-term health impacts, and it results in terms of, if we can embed those positive behaviours and physical activity habits early on, they kind of track through then into later life as well. And without this, then children may experience physical impacts like diabetes, cardiovascular risk, psychological issues such as low self-esteem or bullying, and then social kind of issues as well, which might mean stigma or exclusion if they're experiencing like unhealthy weight throughout life and childhood. So in terms of the key things that influence and the key drivers behind this, and John, feel free to chip in. I can't remember which slide we're chipping in on, so chip in whenever you want to. In terms of the key drivers, there's the environment that would obviously be a big influence on people. What food's available to people in their area, what advertising is influencing people, are things affordable, are there safe places for children to play or travel in school, and also what settings are providing to people as well in terms of food, opportunities to play or physical activity, and the places people can like feed their children in a supportive environment. All those things are going to have a really big influence on a child's weight growing up. And then there's the personal behaviours. So what ups a family are eating, how are they eating? Are they eating together? Are they eating out and about? Are they having school meals? How are they incorporating physical activity into everyday life? When, how and where. So all these things are, a big impact as well. And then also going back to the wider determinants, so poverty, food poverty, housing, access to services, all of these things will have an impact also.
Just jumping in there. So the key determinants really they're very similar to the food and nutrition space. There's some probably additional ones around. There's a lot of peer influence again for certain age groups, usually adolescent girls, but largely the wider determinants. And I suppose looking at it through the combi model, capability, opportunity, and the motivation, they map very closely to the food and nutrition as they do with the physical activity determinants also.
Thanks, Sean. And there's a lot of work that we're doing, John and I are doing with the rest of the team as well, in terms of increasing the proportion of children who are a healthy weight. We're obviously delivering some of the actions from the Healthy Weight, Healthy Well strategy. And this strategy recognises that early intervention is the key to preventing overweight and obesity and promoting lifelong health. And it aims to create environments where children can thrive physically, emotionally and socially, and promoting healthy eating and physical activity from a very early age. And some of the other work that we're working on at the moment is around influencing policy and legislation to protect and promote the nutrition of babies and children. There's some work being done around the Healthy Start scheme, healthy food standards, regulation of marketing and promotion. We're working with Welsh Government and wider partners in terms of the development and implementation of new school food standards, so children having access to nutritious foods in schools. Kind of approach that John was talking about. Working on resources for parents as well. So there's accessible kinds of simple messages that people can take on if they want to be accessing those. And then online training is happening as well. And then some work around the visibility. So things like breastfeeding welcome scheme, which is really about, showing that people are and supporting people to breastfeed in different areas, and also making that more visible to make it more culturally and socially acceptable. John, I don't know if you wanted to come in here with some of the physical activity stuff.
Yeah, thanks, Nick. Yeah, just to expand on the Healthy Weight, Healthy Well strategy. Within that, there's an ongoing program development called the Daily Active, and I'll share something in the chat now. So it's centered around a whole school approach to physical activity, focused on what's known as the daily active 8 domains, which I won't go into detail because you can have a read through. Mainly from the perspective, because we know that physical activity confers largely the same risk reduction or preventative benefits to adults as it does to children. But there's kind of an additional element around, there's a lot of evidence for physical activity is associated with improved cognitive functioning, concentration, attention, memory, planning, all those things that contribute towards, I suppose, improved capacity to learn and that educational attainment aspect. And then if you go back to the very early years or the younger kids, physical activity is key for that fundamental movement skills development, or the wider physical literacy discussion. Because without those building blocks, people are less likely to be physically active later on in life. They haven't achieved or established those core fundamental movement skills at as earlier age as possible. Not that it's not impossible to develop and learn at a later stage, but ideally it is those early years where those are cemented into the individual child, really.
Thanks, John. So I guess coming back to the original question that we were asked to answer today is what can people do to support this agenda in their everyday role? And there's some wider things that people can do around this, depending on what your role is. And everyone can kind of advocate for supportive environments, whether that is, encouraging to have healthy food and drinks at NHS sites or events, encouraging that they're a safe place, or ways to travel by public transport into events, things like that, and promoting the importance of nutrition and physical activity in everyday practice and creating positive atmospheres. So that's something that everyone can do. If you work with other sectors, it's about collaborating across those. If you're working with, schools or community groups, aligning messages or opportunities and advocating within that space as well. And then going back to the wider determinants again, in terms of tackling inequalities, if there's work that can be done that does address food poverty and insecurity through signposts and advocacy and partnerships, these are things that we can all be doing just to kind of, trying to bring this to the table and remind wider partners about the work we're trying to do as well, and embedding it into everyday practice. And then if you are having contact people on one-to-one, I don't know how many people have been involved in any of the MEC training, which is the Making Every Contact Count, and there's different modules there out there for people to access. But in terms of children and young people as well, it's the same kind of principles in terms of the 4 A's, and that's ask, advise, assist and arrange. So it's about using routine contacts really as opportunities to talk about healthy eating when you are in physical activity, when you are meeting with people, part of natural conversations, when it's, in a non-judgmental way. So it could be even just, providing simple evidence-based messages around, fruit and veg every day, or encouraging physical activity, and then advising people or giving people some support around that, or suggesting ways they can incorporate it into everyday life. It could be about, safe routes to schools, or encouraging screen time switch off routines, or, low cost meal ideas, anything along those lines. And then arranging as well, so any support if people needed it. That could be around supporting to food banks, or accessing any services. And you can find out about these sort of things through the local public health teams. We'll know all about these as well. And there's also training available for professionals across Wales. I know Lisa's going to be talking about some of the nutrition skills for life training that's available for people, that people are able to access. There's obviously the MEC that I mentioned as well. And then there are programmes across Wales that you can support to refer into, like the Healthy Start scheme, the Food, Fun and Enrichment programme, all these sorts of things as well. So I suppose it's becoming familiar for what's available for yourself, and then also to be recommended into, and whether that's nationally and locally as well. John, I don't know if you want to add into any of this, or
just very quickly, just to expand on what Nicola said. Yeah, there is a lot of resources out there around that brief counselling, brief intervention kind of space, especially in the physical activity world. It's a really good resource for health and social care practitioners, called Movement Medicine. I'll share the link in the chat now.
Great. And yeah, afterwards, John and I can also list any of these things if you'll want us to on the, and send them out with the slides. I'm assuming they'll be sent out. Yeah, and we can add those to them if people are interested. I think that's it from John and I in terms of where we are, the way, at the moment in Wales, the kind of things we're doing. And I think it's just about thinking about when you are going about your everyday practice, just trying to think about some of these things and thinking, how does your role kind of connect to some of this, and how could you support us in terms of that wider systems work to try and really encourage to have these things as part of your everyday work and stuff as you're going along. And it's easy to kind of add these things so they become the cultural norm then as well.
Absolutely. No, thank you so much. That was absolutely fascinating, but also a little bit scary, isn't it? So there's so much that all of us can do. And I think that every time we interface with a child or a family member in our natural, normal day-to-day practice, there's so many things that we can just do just to try and change the narrative. So the team are going to be populating the chat as we're going along with all the different things that are happening, but also, please feel free to add yours in as well, Nicola and John as well. But thank you so much. Please don't disappear, because we're going to have lots of questions for you, I'm sure, at the end. But if you're happy to wait, what we'll do is we'll continue with the other two speakers, and then we'll do all of the questions at the end. The other thing to say to all of the people listening is that if you have any questions, we're not taking any verbal questions today. So can you put them all into the chat, or if there's anything particularly that you want people to address, then please just pop it into the chat so that we can then pose them to them for you. So we're now going to move on to the second part of this, and which is going to be Lisa Williams. So Lisa's worked as a dietitian in NHS Wales for over 30 years in the clinical, community and public health roles. She's a member of the British Dietetic Association and Public Health Dietitians in Wales, and has a PGC and MA in post-compulsory education and training. She's led the All Wales Community Nutrition Education Programme, Nutrition Skills for Life, and recently has been involved in the digital transformation of nutrition training and community-based nutrition interventions, including development of Foodwise in Pregnancy mobile app, Nutrition Skills for Life website, digital learning and teaching strategy. And her first research project is a scoping review into what works for whom and what circumstances. So without further ado, I'm going to hand over to Lisa, who'll be able to explain so much more about her work in a much more eloquent way than me. So over to you, Lisa.
Thank you, Claire, and thank you ever so much for the opportunity to be part of this webinar today. Pranhanda, everybody. I'm Lisa Williams. I'm a dietitian based in Cardiff and Vale University Health Board, and I lead the All Wales Public Health Nutrition and Dietetic Programme called Nutrition Skills for Life. I'll explain a little bit more about the programme and what dietitians do, but our main focus today obviously is on what we can all do to promote nutrition for children's health and well-being. So moving on, so why should food and health be promoted in our everyday practice with children and families? Well, as we've heard, nutrition is essential for life. The food we eat influences every cell and every system in our body at every age and stage in life. It's especially important for children for growth, development, both physically and cognitively, and for activity. And because eating habits that can last a lifetime are formed in early life. Adequate nutritious food can reduce our risk of developing illnesses such as type 2 diabetes, coronary heart disease, stroke, and some cancers that can shorten our lifespan. And we also need to consider its impact and influence from our food system and the environment, and promote diets that have low environmental impact and are consistent with good health. So nutrition is everybody's business. We all eat, and nutrition connects food to health, but it is complex, as we've heard. Where we live and what we earn shape the options available to us, including our access to affordable, nutritious food. So in terms of general principles and children's diet, childhood and adolescence are periods of rapid physical and cognitive growth. The government guidelines for meeting children's nutritional requirements are based on the Eat Well Guide. And in brief, the main messages, and this is a brief overview, is the main messages are to eat at least 5 portions of fruit and vegetables a day, and these provide vitamins and minerals needed for a healthy immune system, to be able to fight infection and recover from illness, and reducing school absence for children. They provide fibre to help with digestion, prevent constipation, and to boost heart health. We should base our meals on high fibre starchy foods. These provide energy and obviously fibre. and include dairy or dairy alternatives. These provide calcium for strong bones, particularly during periods of rapid growth, so that young people reach their peak bone mass. And vitamin D is vital for calcium absorption. So there are few dietary sources of vitamin D, and we have limited sunshine in the UK. So supplementation is needed in the autumn and winter months. So children 6 months to 5 years should have a vitamin supplement containing vitamins A, C, and D every day. And breastfed babies should have vitamin D from birth. And if people are having plant-based milks, it's advised to make sure they have added calcium and iodine. Should be including beans, pulses, fish, eggs, meat, and other proteins. These are needed for growth and repair, and they contain iron, which is needed to make red blood cells, and vitamin C from fruit and vegetables aids iron absorption. Unsaturated oils and spreads are needed for brain development, for energy, and to absorb fat-soluble vitamins. Milk and water are recommended drinks, and it's recommended to avoid sweetened and fizzy drinks to protect teeth. Avoid tea as it contains tannins that can prevent iron absorption, and limit fruit juice and smoothies to 150 ml a day because of the free sugar content. Limit foods high in fat, salt, and sugar to protect teeth for overall health, and also keep to regular meal times and nutritious snacks. So the Eat Well Guide doesn't apply to under 2s, as they have different nutritional needs, but after 2 years of age, children should move to eating the same foods as the rest of the family in the proportions shown in the Eat Well Guide. So they are the recommendations. But as we've heard, in terms of children's diet, come over the next slide, Sam, please. Thank you. In general, we're not meeting the Eat Well Guide recommendations. So the latest National Diet and Nutrition Survey report was published in June this year. And this looks at diet, nutrient intake, and nutritional status of the general UK population from 18 months and over. Saturated fat, sugar, and salt intakes are above recommendations, and fibre, fruit, vegetables, and oily fish are below recommendations. On average, children 11 to 18 years consumed 2.8 portions of fruit and vegetables a day, and only 9% met the 5-a-day recommendation. And a secondary analysis of multiple observational studies in the UK, including the National Diet and Nutrition Survey data, found that less than 0.1% of the NDNS sample, which is representative of the UK population, adhere to all 9 Eat Well Guide recommendations that they looked at. And the study showed that better adherence to the Eat Well Guide can lead to a 7% reduction or reduced risk of total mortality and a 30% reduction in greenhouse gas emissions. So in terms of what dietitians do, well, dietitians are one of 13 individual allied health professions. We interpret the science of nutrition and translate it into practical support to enable children, young people and families and communities to eat and drink well. We take a whole systems approach, recognising that broad structural changes across all levels of the system are needed to support population level health improvement. And we work from primary prevention through to tertiary services, supporting people who are otherwise well or people who may be on a treatment pathway, identifying opportunities to maximise health and wellbeing at different touch points along their pathway. For both universal and targeted services, with a focus on proportionate universalism, where services are provided at a scale and intensity that's proportionate to need. And we utilise a biopsychosocial model encompassing wider psychological, social and environmental factors that can impact on health. And a community development approach to enable people and communities to find solutions to challenges they face and focus on assets rather than deficits within communities. And we work within different specialist areas of practice. But moving on to nutrition skills for life in particular, which is my area, dietitians deliver the All Wales programme. So we have dietitians in each of the 7 health boards, aim to build community capacity to widen access to nutritious, affordable and sustainable food. So we do this by shifting our focus and redesigning services towards primary prevention through skills development, supportive environments and community action. And so to develop personal skills, we deliver a range of accredited nutrition skills courses for staff. This supports making every contact counts, for example. So as you've heard, supporting others to promote generic food messages. And the healthy eating messages are ones that would apply across the board to most people, such as 5 a day, swap high fat, high sugar foods drinks for healthier options and eat smaller portions. And we deliver training as part of other curricula then, including midwifery, health visiting and school nursing, dental health nursing, children's care, play, learning and development, and health and social care qualifications. And this training supports other organisations to create supportive environments for health and wellbeing by developing food policies in their setting to improve food and drink provision, for example. So, for example, for early year settings and schools. And by strengthening community action, so that people can be active agents for change within their own environment. So involving people with those lived experiences is essential to fully understand the wider influences on food and enable people to find solutions to the barriers and challenges they may face. So what everyone can do, so our topic for today, is have those healthy, compassionate conversations. So open with talking about children's health, not weight. Focus on the food around us, and that there should be fairness in terms of the food available to children and families, which isn't always the case. And find out people's lived experience and the realities of food in their everyday life. It's important to convey those consistent evidence-based nutrition messages that relate to people's individual situations. Always check and ask their permission first. It's important to eliminate stigma, particularly weight stigma, by perhaps focusing on food and healthier nutrition for all, because we can all benefit from healthier options. And this is regardless of body weight, and recognising people's realities and lived experiences. So it's not an issue of personal failings or choice, more of opportunities and options available, and that this isn't always equal, including access to affordable nutritious food or access to support and services where needed. Refer to dietetics if more tailored advice is needed, and explore the Eat Well Guide web pages and booklets for evidence-based food and nutrition messages. Look into nutrition training available through Nutrition Skills for Life. Be aware of and promote local and national food initiatives, including Healthy Start, and then role model healthy eating in settings and workplaces. I am conscious of time. I think I've only got a couple of minutes left, so I am going to skip over. I have got a slide which includes the difference that the programmes and the training that we're delivering are making, but I'll just to say some of the outcomes that we are seeing. That's okay, the next one's fine, Sam, thank you. So we're seeing a difference both at the individual and organisational level. Changes are often wider than changes to eating practices and include, as you can see, I won't read out these quotes, but these are some of the quotes that are just a small sample of what we have back from some of our programme evaluation, but it can make a difference to improve mood, confidence to interact with others, and confidence and self-efficacy to make changes. And also staff reflect on their own situation and gain confidence to deliver food and health sessions for children, or gain a sense of pride in their efforts to put nutrition knowledge into practice and raise standards of care. So, for example, with our early year schemes, where they're putting the food nutrition best practice guidance into practice in health. And then just moving on to some of the resources. So we talked about the importance of evidence-based, consistent nutrition messages and that concerted effort by all to pass on those evidence-based messages within communities and through our work. And these are some of the things I think they've been in the chat as well. First Steps nutrition resources. We've got a Foodwise in Pregnancy app. There's Healthy Start e-learning for all staff, which is mandatory for all staff working in the NHS with children under 4 and families. There's the Nutrition for Your Little One website, and that's a Cardiff and Vale-based programme. The website's accessible to everyone. Have a look at our Nutrition Skills for Life website, and then these are some of the other resources. The Welsh Government Food Nutrition Best Practice Guidance for childcare settings. Public Health Wales is Every Child, resources including introducing solid foods, and I've mentioned the Eat Well Guide booklet that's on the Welsh Government website that people can have a look at. And then the final 2 slides have just got some lists of additional resources and a reading list of some of the references I've included in the session today. I will stop there, but thanks, Claire.
So that's
time-wise.
Yeah, no, absolutely perfect, amazing. Thank you so much. And yeah, just lots and lots of food for thought, isn't there? And yeah, we're going to be putting all of the different resources into the chat. Hopefully some of them have been coming through, but also we'll share the slides if you're happy, Lisa, because I think that would be really helpful for people to be able to look at some of the information that you've got there. But thank you, that was absolutely brilliant. And if you don't mind hanging around again, so that we can do the questions at the end. But what I will do is I will hand over now to Katie. So Katie Palmer is the founder and head of Food Sense Wales. She's worked in the world of food for over 20 years, with experience in both the private sector and the third and public sector. She's a founding member of the Veg Power Board, as well as being the founding member of the Food Policy Alliance Cymru. She also sits on the WLGA's School Holiday Enrichment Programme Advisory Group and was one of a team of 4 who created the multi-award winning Food and Fun programme in Cardiff in 2015. So I'm going to hand over to you. And I meant to say, sorry, the speakers, please feel free to have your cameras on. It was only just we didn't want all of the audience, all 200 of them in the screen. So but it's nice to see all of your faces. So thank you. Over to Katie.
Thank you. And yeah, there's just an incredible amount of information that's coming over the over Microsoft Teams. So yeah, but I think you'll see some replication here as we go through the slides. So hopefully that will be helpful. So yes, I head up Food Sense Wales, which is a charitable fund hosted within Cardiff and Vale Health Charity and the local public health team. And we work with stakeholders across Wales and the UK to co-create a food system in Wales that's good for people and the planet. You can move on to the next slide there, Sam. So there's 3 main pillars to our work. We're working around building a positive food culture in Wales, catalysing a revolution in local and sustainable procurement, and supporting the development of good food policy in Wales. So some examples of our current work including helping to build new veg supply chains in Wales and building a network of local food partnerships across the country. And both of these things are really relevant to supporting children to be active and healthy, as I hope will become evident as we move through the slides. So the next slide. So I thought that might be helpful from the outset to frame my thoughts around 4 things that individuals can do to support children and their families and carers. I will go through each of these in turn, and I think again we'll be getting links in the chat bar as we go. So we're going to talk about understanding supports available and how to signpost, seeking out your local food partnership, being aware of initiatives that can support healthy eating and spread the word, and then ensuring that your workplace is leading by example. So on to the next slide. One of the things that we know well is that those on lower incomes have poorer health outcomes, as Nicola highlighted. We also know that the cost of a healthy diet is increasingly difficult for many families to meet. But there is help available, and often it isn't claimed by those that are entitled to it. So Welsh Government launched a campaign, Claim What's Yours, and is encouraging people to find out what support they could receive. So there's an Advice Link Cymru link that can be accessed through the website, and there's a free phone number as well. And between April 23 and March 24, advisors helped over 36,000 people with 120,000 issues. But there are also a number of food-specific schemes available. Free school meals are often the only hot meal a child receives in a day and are therefore really important for their nutrition. As we've already heard, Welsh Government have rolled out free school meals to all children in primary schools across Wales, but a couple of important points are worth highlighting here. Even though every child is eligible to get a free school meal in primary school, if you or the person you are supporting is eligible for a free school meal, they should still register by signing up with their council. This is really important because it unlocks additional resources for the school through something called the Pupil Development Grant, and it could help the claimant to access other potential benefits such as the School Essentials Grant, which helps with things like uniform. In secondary schools in Wales, children are entitled to free school meals if their rent income is less than £7,400 a year. In England, that threshold is going to be raised so that more children in secondary schools and primary schools in England are eligible. This is something Welsh Government are looking at. The Child Poverty Action Group estimate that the number of secondary age learners in Wales who are in poverty and currently not eligible for a free school meal due to this 7,400 means test is around 25,000 young people. And this could have been a stat we started at the beginning, but they found that the minimum cost of a year at secondary school is now around £2,300 a year. So in all of these things, the council is the first port of call. Breakfast clubs offer a free healthy breakfast in some schools. Again, you have to contact your school to see if they have a free breakfast club. We've heard Healthy Start mentioned already, but just to clarify that is a scheme to help expectant mothers, new parents and their children to eat healthily. So if someone qualifies, you can get free vitamins and a voucher towards the cost of milk, vegetables and fruit. We've heard Food and Fun mentioned, which is a Welsh Government funded scheme held in the school summer holidays and includes fun activities and meals for children during the holidays, often in their own school. Children have the opportunity to learn about food, enjoy food and fun with their friends and get involved in a huge range of activities from sports and music to 3D printing and circuit skills. So again, this is contacting your school to see if they run the scheme. The scheme is supported by community dietitians, as Lisa just mentioned. So all of the health boards are involved in Food and Fun, as well as local authority catering and schools and a host of other partners. And it's coordinated nationally by the Welsh Local Government Association. Then there is a job to seek out initiatives in your local area. These could range from food banks and pantries to holiday clubs, flying start centres, community meals, growing projects and food education. This is where food partnerships comes in and brings me to the second call to action. Seek out your local food partnership. This could be in a personal or professional capacity. And rather going through that list there now, I think we'll go straight on to the video if that's possible. We haven't got any sound.
Bear with me, I'll just do that.
Together partners from a range of different sectors to help tackle social, economic and environmental issues, working together to ensure good food for all. Food partnerships work across sectors, bringing key people together to develop a vision for a more sustainable food future that's tailored to their local area and responds to its specific needs. They were pioneered in the UK by Sustainable Food Places, a UK-wide network that makes healthy and sustainable food a defining characteristic of where people live. In Cymru, there are 22 food partnerships, one in each local authority area, promoting innovation and best practice in healthy and sustainable food systems. Food Sense Wales supports and nurtures the food partnerships, bringing them together, providing leadership and opportunities for collaboration. Wales is proud to have bronze, silver and gold award-winning food partnerships, a testament to the hard work and collaboration happening across the country. Partnerships include public bodies such as health boards and local authorities, as well as citizens, voluntary organisations, charities, food businesses, retailers, wholesalers, growers and farmers. Local food partnerships in Wales are led by a coordinator and receive support from Welsh Government. Food partnerships take a systems approach. They address a range of different yet connected food issues and work together to achieve change. Issues like household food insecurity, ensuring access to healthy, nutritious food for all, and building resilient local supply chains that reduce carbon emissions, promote nature and support the local economy. But local food partnerships do much more than figure out solutions to complex problems. They drive change, inspire ideas, enable innovation, and empower communities to engage with good food-related activities, just like the ones happening here, and here, and here. Food Sense Wales believe that investment in connected and resilient local food systems builds and retains wealth in Wales, economically, environmentally and socially, and helps to promote collaboration and inclusivity. Local food partnerships are central to this vision and can help make real, positive change to communities across the whole of Wales. So what is the best thing about being part of a food partnership?
The people involved are really, really inspiring. We don't have to stay in systems that are producing unhealthy outcomes.
Everyone's impacted by food in life. Things in Cardiff would be different to things down Anglesey, but it's great to have that network of people that are all working towards the same goal.
It encourages people to think differently and work differently.
Really made me passionate about the power of being part of this social movement, seeing all the good work going on in the ground and being part of that change.
People working together and creating things that are more than the sum of its parts.
For me, it is ideas, I think, just hearing other organisations and their ideas and discovering we're all on this journey together. You can do more together than you can really apart.
Together, we can build a better, more sustainable food future for Wales.
Thank you. And as you find the next slide there, I'm going to skip that one, move on to the next one. So I was just to say that there are more, there are links on food partnerships. There is a food partnership in every part of Wales. Some are more developed than others, but all are being supported by Welsh Government at the moment to expand. So the next area is to say really to be aware of initiatives that can support healthy eating and to spread the word. So there are national campaigns and activities where your help with spreading the word could really support building momentum for these initiatives. So one example is Welsh Veg in Schools. And Welsh Veg in Schools is a movement of stakeholders striving to increase organic horticulture in Wales for the benefit of current and future generations. And there's a huge number of stakeholders across Wales involved in this, from growers, wholesalers, local authorities, schools, food partnerships, and organisations that are supporting farming. We're working to grow the horticulture sector in Wales through this initiative because we produce very little fruit and veg in Wales. And the plan is to get local produce on children's plates in schools and to work with schools to help drive up consumption by inspiring kids about where their food comes from and helping to connect them with the growers and farmers that are producing the food on their school plates. And there's a lovely podcast that's been put in the chat as well, where the children are talking about that. But can we flip back again quickly, because I've got one more thing to say on that last slide. So one of the initiatives that schools have been running through an organisation called Veg Power, which is a not-for-profit alliance dedicated to improving children's diet by making healthy, sustainable eating irresistible, starting with vegetables, but now also working on fruit and most recently beans to support parents to make healthy eating easy. One of the campaigns that Veg Power has conducted that Welsh Government have supported is the Eat Them to Defeat Them campaign, and it's been running in Wales for some years now. It's a multi-award winning campaign combining the power of advertising with a schools programme. And the most recent stats in this campaign show that 60% of parents whose children have taken part more than once report a lasting and long-term improvement in the volume and variety of vegetables that their child eats. So there's lots more on the Veg Power website, and I guess some people who have children have their kids have probably come home with sticker charts at some point. On to the next slide, and the next one. Fantastic, thank you. So the final call to action when we can be thinking about supporting everyone to be active and healthy is to check that your workplace is leading by example. This has already been alluded to by previous speakers, but quite frankly, if it isn't, call it out. So, for example, are vending machines in hospitals, council buildings and leisure centres supporting healthy choices? What does the non-patient food look like in your hospital? Does the environment support healthy choices? Have a look at the advertising around you. And I'm just going to leave you with a bit of a success story, really, is that Cardiff and Vale University Health Board, together with Cardiff Council and the Vale of Glamorgan Council, have been working collaboratively to progress action that restricts high fat, salt, sugar advertising. Planned policy changes, which actually for Cardiff were announced over the weekend, and the Vale just before that, I believe, will restrict HFSS advertising on council-owned and contracted sites across regions, increasing the space for healthier advertising alternatives. And another example of where Health Board are working on this is with Betsy Cadwallader, where they're working with planning departments to factor in health as a consideration in local planning decisions, which we know is very problematic in some parts of Wales. Finally, what assets has your workplace got that could benefit active and healthy lifestyles? Morriston Hospital, which is growing vegetables at Caerfellin on land owned by Swansea Bay UHB, have got really exciting plans, including how they're going to start growing for the Welsh Veg in Schools programme, and how they'll support with community initiatives through the support of their local food partnership, Boyd Abertawe. So, to summarise, understand what support's available and signpost, seek out your local food partnership and get involved either as an individual or as an organisation. Be aware of initiatives that can support healthy eating and spread the word, and ensure your workplace is leading by example. And if it's not, call it out. We've all got a responsibility to contribute to the change. Joch and Val.
Thank you. That was absolutely fantastic, all four of you. We've got a couple of minutes now for questions, and I think we've got some questions for all of you, actually. So we've got some questions about, can individual schools engage with Welsh Veg in schools, or does it have to be done via local authority catering teams, is one question. So I don't know whether that would be for Lisa or for Katie.
That'll be for me. So there are 13 local authorities that are currently involved in Welsh Veg in schools, and we're working with schools that catering teams have recommended, because there are some challenges around, you know, different needs of the kitchens and things like that. So there's only certain schools that are getting involved at the moment, and the schools actually are about to send out letters, and the schools that are getting involved will be sending out letters too, so they'll have a bit more information. So it's still very much in its pilot stage, but as the years roll on, hopefully we'll have more and more schools involved.
That's brilliant. And somebody else mentioned about the vending machines and the things that are available within health premises, and I think that actually is a really important thing, isn't it? And something for all of us to be calling out, as you say. Somebody else asked about the video for the food partnerships, which showed children being shown around sites and learning about growing. Is this something that organisations can access? Now, I'm not sure if that's accessing the video or accessing the children being shown around.
Well, I can answer both.
Yeah, I'll go for it.
I can answer both. So the videos are online. In fact, we've got some other videos which shows specific work of some of the food partnerships, which are worth a watch if you're interested as well. It very much depends on the community garden and things that are working. So, you know, one of the things that schools are doing are starting to increase to get gardens and growing spaces in their own school, and that's something that we're really advocating. But there also schools are working with places in the community as well. So, for example, in Cardiff, we've got Cardiff Salad Garden, where we've done school visits there, and there have been some school visits to the Welsh Veg in Schools growers as well. So it's a really mixed bag, but seeking out the food partnership would be one of the ways to start.
Absolutely. No, that's absolutely fantastic. So somebody else has asked, I'm just conscious we're not going to be able to do all of the questions, but this might be one for Nicola, or probably is for Nicola actually. Is anyone aware of the plans to update the Welsh Government 2012 Health Promoting Hospital Vending Guidance? I don't know, Nicola, John, I don't know if Rachel's around, but one of you will probably know from that perspective.
I haven't got the answer to that question right now. I know work is being done in terms of NHS settings, but I don't know about the guidance specifically, but I can find out.
Oh, that would be really fantastic. Sorry to put you on the spot like that. So that would be really helpful. And then is there any collaboration with Grow Cardiff, as somebody else was just asking?
Yes, Grow Cardiff are very tied in with the Food Cardiff Food Partnership, and they've also just been involved in a pilot called the School Food Hour, which is trying to bring an hour of learning about food, eating food and learning through food. And one of those activities has been working through with Grow Cardiff. So yes.
Absolutely. Yeah. No,
we've also got links in dietetics there, Claire, just to say there's links within dietetics, because Cardiff and Vale Dietetic Community Department is based in Riverside Health Centre, so there's been some joint working with Grow Cardiff there as well.
Fantastic. So many different questions. I'm sure that people can reach out to our speakers as well. But somebody was just saying about the master's dissertation on weight management in children and young people with learning disabilities, and I think that's a really, really important area to be considering. You know, about the disadvantage and lack of intervention in that area. I think there's lots to be done for that group across the board, not just around healthy and active lives. So absolutely. I'm really sorry, we only have 3 minutes left, so we're going to have to not have any more questions. But because we just need to do the last couple of slides, which is just the Mentimeter again, which is just to find out whether we met your needs, what we could do differently, what your take-home messages are, and also what do you want to hear about in the future. We've got a whole load of ones up our sleeve. The next one's going to be about the early years, which should be really interesting. But please, if you don't mind, sorry, my dad's joining in. Please, would you all mind just doing the last 4 slides? It's very quick. That would be really fantastic. And while you're all replying to this, can I just say what a fantastic group of speakers, such a lot of innovation, such a lot of knowledge, such a determination to really take this agenda forward for the babies, children, young people in Wales. So I think we're in good hands. But I really appreciate all of you coming along today, and especially as we set you the mean feat of covering a massive subject in about 20 seconds each. So really, really appreciate it. And this is, as I say, just a taster, just a snapshot for people so that you can think about it more, you can reach out. There's lots more information. We will develop a Padlet or information resource with our colleagues who've spoken today, so that we can send it all out to you, because I agree with you, it's really helpful to have everything in one place, isn't it? So absolutely, our team can pull something together and share with you all. So vaping, yeah, vaping is one that comes up every single time. Early years we're doing next time, which will be great. Sleep is a good one. Additional learning needs, 100%. Yeah, fantastic. Please don't think we analyze, we look at every single bit that comes in from this. We've got all the records of all the things that anyone's ever asked for, and we then try and really target our what we're talking about. But also, if people have got ideas about good speakers, then please let us know as well. So what support would your team need to embed a children's rights? This shouldn't be children's rights. This should be about embedding. This actually should be about embedding this work in your, the food health work into your day-to-day work. So actually, what will you need to be able to embed that? Oh, hang on, we've moved on. That's okay. We won't. That's fine. On a scale of 1 to 10, how did the webinar meet your needs today? Apart from the chair getting confused. Yeah. Sarah Osler has asked whether there are any plans for universal child measurement programme before the age of 4 years. I don't know. I don't know whether any of our other speakers are aware. I don't know, but we can find out.
I think before 4 years, children's weights are taken as part of the Healthy Child Wales programme. I think Nicola might know more, but Public Health Wales, I think, are looking at some of that data that might be available around, what's already being collected as part of health visiting and Healthy Child Wales measurements. So there might be some of that data there. And there has been discussion about, like in England, doing the second measurement at sort of age 11. But, that's been quite, there hasn't been agreement around that.
Absolutely, yeah, absolutely, yeah. That has been discussed about with Healthy Child Wales too. So the next question: what will you take away from this webinar today? So this is just for you all just to put in anything that you've learned, anything that you think has been useful, resources, signposting. I know, I mean, it's so important when I sit in clinic, it's so important to have things that you can just share with your families when they're in there, so they actually feel like you're not just giving them lots of jobs to do, you're actually helping them. Absolutely. Compassionate conversations, absolutely. Reminder of the basics. Yeah. Brilliant. Well, thank you again to all of us, because you've been absolutely wonderful. It's been fantastic. Really appreciate it. I'm sure you're going to have lots of people reaching out. People can contact us at the Child Health Network, and we can put you in touch with any of the speakers if you've got questions and things. And like I say, we will be sending out all of the resources out to all of you. So thank you again. Our next webinar is actually on World Children's Day, which is in November. So we should be sending out the flyer for that in the next couple of weeks. But it's going to be all about early years and early intervention. So that should be a really fantastic one as well. Brilliant. Well, thank you so much, everybody. Lovely to see you all.
Yeah, bye.
Thank you. Bye now.